We are now recording.
Good afternoon and welcome to the Lawyer Assistant Program Oversight Committee meeting of the State Bar of California. As a reminder, this meeting is being recorded. Under the Bagley-Keene Open Meeting Act, remote members of the committee must be visible on camera, and they are, unless such appearance would be technologically, there you go, technologically impossible or impractical. If so, the member has to announce the meetings reasons, for their non-appearance during the roll call. Remote members must also disclose any individuals aged 18 years or older in the room with them. Erica, would you please take the roll?
Yes, Heather Benton,
Here.
Lisa Johnson,
Here.
Deidre Nguyen, not present. Ryan Peterson, not present. Elise Yenny, not present. Catherine Young,
Present.
and Jim Hiding.
Present.
Believe we have a quorum.
Thank you. Next on the agenda then is a call for public comment. Is there any member of the public on the call or in a remote service that wants to speak or anything?
Um,
I'll note that
no,
Ryan,
there are no members of the public. We've indicated that would like to give public comment at this time.
thank you. I'll note that Ryan Peterson, member of the Oversight Committee, just came on. Ryan, would you announce yourself, please, and tell us you're present?
Hi, Ryan Peterson. I'm present. Thank you.
All right. It's 2:03 p.m. Thanks for joining us. Good to see you. Having no public members, no comments on public members, then I would please ask Erica. Excuse me, I would just go to the oral report, and I would like to note that this is or would be Elise Yenny's last meeting. She was our professional in the mental health field, and so she was expected to have this last meeting, but she was unable to attend. Her term concludes before the next meeting that's scheduled, and so we have been working to fill that spot, and Michelle and I have been doing some work with that I'll just report in a minute. We certainly do appreciate, though, Elise's continued contributions to the Lawyer Assistance Program, and we all wish her very well. Does anyone want to speak to that at all? You're certainly invited to do so if you do.
I would just say she really did a good job. I was on the successful homeworks committee. I forget exactly the title, but with her, and she was very bright. She was congenial, easy to work with, had some great ideas. So I think she will definitely be missed on this committee, and her contribution was important and worthwhile.
It was that position is a very important position. Anybody else? Okay, we still need a vice chair for the committee, the Oversight Committee, and so if you're interested, please contact staff and indicate your interest so that we can move on that. Little report, since our last meeting, we submitted the work plan to the Board of Trustees, and I've spoken to Patrick Krill, who was instrumental in the survey that was undertaken I think it was published in 2021 with the American Bar Association, Betty Ford Center, and the Hazleton facility that spoke of attorney implications of alcoholism and drug addiction and mental health. And I asked for an update on his survey, which, he they provided a new survey to update everything that had been disclosed in 2021, and that should come out very shortly. So he's looking forward to doing that. I did note in that study, however, that people such as me were kind of left out. I mean, as far as the survey of how life has progressed in sobriety. So they spoke of the questions were kind of indicated to look to people who are actively involved in the disease process or actively involved in alcoholism and drug addiction or that sort of thing. But they didn't speak to after you've been sober for X amount of time, what is your view on things? How is your life progressing? What is happening with you? And so that wasn't really covered. I thought that was a big blank in the study, and I told him so, and he promised to do something about that in the future. So I've spoken to Patrick Krill. The financial assistance grant study group has been meeting, and Heather Benton will give a report on that. And shortly, I have been working with Ken. Of course, several of us have been working with Ken to put together the MCLE programming, and he'll speak to that shortly. I've been also asking to study the financial allocations and our income and expense for this program, trying to find ways to reallocate, maybe bookkeeping entries or moving things around, how to provide services, get some financial support that we will need in the future. We need to explore, I'll tell you, other resources, perhaps volunteers, maybe other methods of providing services. We need to find some imaginative ways to provide our services to those in need, and to uh, do that, we have to communicate the availability of our service and educate people on the needs and value of recovery services. And the reason I say that is because, as you probably know and can imagine, especially with inflation taking place, that the services that the staff provides and the cost of staff and office facilities and IT and insurance and all of the rest of it goes up and up and up and up. And yet our income is pretty stabilized and static because of the number of admittees and we get an increase somewhat, but we get $10 per active member of the state bar, and then we pay out 10% of that, 1/10 of that, to the other bar for their voluntary services, and they provide a lot of service for that money, but it reduces our income. So somewhere along the line, uh, I wrote down what this was costing us. There it is. Okay, so we had an income last year, 2025, of $2,224,828. 2,224,828. Uh, and then we paid out in staff and employee costs 1,200,000 plus or minus, which leaves $1 million out there. And I'm trying to figure out where and how that is allocated, because I want to see if I can ask for a different allocation, different interpretation of things so that we can save a few pennies here and a few pennies there. But in any event, the whole sermon is to discuss the idea that costs are going to increase naturally. They're just going to. And it's nothing we can do about that. I mean, salaries are going to increase, benefit costs are going to increase, office expenses are going to increase. All of those things are going to increase, in our income, unless we do something legislatively and get a better cut of the pie or increase our income that way, we're going to be stabilized. And so we're going to have to look at that pretty hard in the future. So please think about some imaginative ways or ideals that we could use volunteers. And I'm sure people like the other bar members will be happy to help out, but we have to figure out how that's going to occur. Michelle and I have also been reviewing applications to fill the mental health professional slot to be filled after a lease terms out. in September, and we received and reviewed applications and conducted interviews, evaluated candidates, and have submitted them to the Board of Trustees. So they'll take over their decision making, and hopefully will meet our new mental health position in September. So with that, I think we'll move on to, well, does anybody have any questions about any of that? Okay, nobody, nobody looks like they have questions. And at least you're all staying awake, so that's a good thing. Yeah, Heather's got a question,
Yeah.
yes.
In terms of our income, does it roll over at end of year? Or is it like the other income we have where it just sort of stops? And is there a way to roll it over if there's anything left to kind of,
Well, I think our income is our income. There was a moment in time when the state bar took and deposited our funds into the general fund, which was revealed through an audit by the legislature, and then they had to return the funds to us. So I'm sure it rolls over. Is that Michelle? Is that right?
Sorry, my mic wasn't on. Yes, that is correct. It's all a restricted fund, and so all the money that's collected for LAP will stay in a LAPS fund.
Okay.
If there is any at the end of the year, which
Yeah.
at this point there has not been for a year or two.
have we been able to pay our bills and stuff? Or are we, pay for everything we need, or is it coming up short?
Well, we can go ahead.
We're right at about, I see Erica, you've turned your mic on too, if you want to contribute, but
Go ahead.
we're right at about even that I mean I would at this point say yes. The money that we have discretion in, this might come up later in the working group's response, but the financial assistance is a chunk of money that we earmark in advance for paying out for financial assistance, where this group can have some influence over how that's distributed or how much is distributed. Otherwise, the rest of it is very it's really kind of up to the accounting formulas of how much we end up paying out to IT and HR and um, what's the other, general services. I'm trying to think of what the other offices are that don't bring in their own funding, but then they provide services to our office. So really, our expenses are the staff, which Jim said is the largest expense, is salaries and benefits that go to staff. And then it's the services we get from other offices in the state bar. And then there's the amount that goes over to the other bar, and then our professional services, which are the providers who pay out of the financial assistance money.
So I guess my second question then is in terms of staff retention and hiring with the budget, are we able to give staff like pay increases because our budget is pretty static? Like Jim said, we get the 10%. They haven't really increased the fees. Are staff able to get pay increases? Is it impacting employee retention? Like, is there something that we need to look at to advocate for us to get a higher allocation?
We will not be able to hire more staff. So although, and I think Ken might mention this in his report, we have gotten a lot of calls lately if somehow people are finding out about the program, and hiring more staff is not going to be an option. Right now, we're able to maintain the staff that we have, and they're all union employees, and so they have contracted step increases within their, or I don't think we call them steps anymore, but increases within their contract until they reach a cap. So we'll be able to cover what the staff salaries are for the current staff that are here.
And I think I'm not so sure, but we might make a push to the Board of Trustees or to legislators to give us some support in getting increased funds. But Michelle spoke to me about that and has indicated that staff has presented that as an option in the past to higher ups, and they've shown no interest in doing that. They have other funding interests that have priorities, apparently. So,
Yeah. It's not just
uh,
LAP, it's the entire state bar is
right.
struggling with funds. So
Maybe
go
I can
ahead.
speak a little like context. Maybe that would be helpful. So we as an organization have certain funds. So we have our general fund, which is the fund that most attorney licensing fees goes towards, and that's to fund the discipline system as well as many other things within the organization. We have an admissions fund, and then we have specially allocated funds. And so those specially allocated funds are the admissions fund, which is primarily funded through bar applicant fees, our multi-jurisdictional practice. So that's if you're a registered in-house counsel, but you're not licensed in California, temporarily appearing in California, perhaps pro hoc vice or otherwise, those types of things. And then we have the lawyer assistance program and we have the client security fund. So those are our primary funds. We also have grant related funds that we administer to legal aid organizations, which is a separately retained fund as well. So those are, I may be missing one or two, but those are our large funds for the most part. And organizationally, so for those who don't know, we are subject to ourselves as an entity is regulation through two separate channels. So that's through the legislature who enacts statutes that we have to adhere to, and then also through the Supreme Court. So on an annual basis, as Jim has been indicating, the legislature sets our annual fee, and that includes the fee that licensed attorneys pay. And then there are subparts of that that are allocated. So a large chunk of that is to the general fund. As I mentioned, the $10 goes to lawyer assistance program, $40 goes to client security fund, and so on and so forth. And so typically, those funds that have a specially allocated fund, so lawyer assistance program, CSF, otherwise, are funded through that particular fund itself and not the general fund, which is, like I mentioned, used mostly for discipline. Organizationally, we, pursuant to statute, have been asked to operate with a aspirational goal of a 15% vacancy rate. So that's what every component of the state bar is working within. So there's, not every office has a 15%. Some offices have a 20%. Some offices have a 8%, and so on and so forth. But that's kind of what we're operating within. And there is a temporary $52 increase to the general fund that exists that we have until it's going to sunset in 2027. And so the goal here was to basically work towards that vacancy rate and see at that time, do we still need that $52 to support the general fund and the fees and so on and so forth. And I'm giving you much more information than you may want to know or need to know, but just I think it sets the stage a little bit for kind of the overall context in some of this. And so myself and many others in the organization are working with our legislative stakeholders to kind of figure out the sweet spot, if you will, as to what we need, where we're not trying to raise licensing fees because that can negatively impact attorneys, and also do the public protection function that we need to do, which of course includes the lawyer assistance program as a key component of that.
Thank you, Erica. That's informative and helpful. Two areas that have increased, that have required increases really are the client security fund, which of course is to help protect the public and very essential to refund money that has been taken due to the wrongful acts of the lawyers, and the trust audits, that are occurring and that they have to fund now. And so those two things. So you can see that increases in expenses are going to continue to occur. But I do want to point out to anybody listening that the lawyer assistance program provides an extreme support of client protection, in that they provide attorneys to be competent and healthy and capable of properly representing those clients and properly counseling those clients. And so I think it would be short-sighted for the board or the legislature not to support the LAP in full. So if we keep that in mind, and we keep in mind how important the lawyer assistance program can be to the healthy protection of clients, I think that we should be able to support our arguments for funding pretty well. Any other comments? All right, so Let's move on then, please, to staff reports, which is the next item on the agenda, I believe.
Ken, you want to go
Michelle,
ahead
do you
with?
have anything?
Well, I only briefly will say regarding the monitoring side of the LAP, we are keeping on. I think Ken is going to mention because Ken's role connects with in taking the new callers that we've had somewhat of an uptick recently since our last meeting. And I don't think you all will talk about this in the financial assistance report, but I don't think I said at the last meeting that the financial assistance fund has now been exhausted for the year. Um, I think that happened in April, so that was after our last meeting. So, so that's important for this committee to be aware about, and that's why we have a working group that is going to be working on how we're allocating our financial assistance fund.
Okay, Ken? Thank you,
Yes,
Michelle.
I'll talk about sort of the volunteer support side activities for the lawyer assistance program. We currently have the Reset Bar Retaker Support Program underway. We had our first session, which included Resilience Reset on Monday. This program includes mental health support strategies to help combat the stress and anxiety of retaking the bar exam. It's actually quite popular. We're in the process of posting to the Lawyer Assistance Program website a new prevention and detection toolkit that will allow members of the legal community to put on their own MCLE. It's entitled Alcohol, Health, and Attorney Wellness, Navigating Risks and Professional Responsibility. It reviews findings of the January 2025 U.S. Surgeon General's report on alcohol and cancer risks. It also includes a portion to allow an attorney who's in recovery for alcohol use disorder to tell their recovery story. And it also, of course, focuses on resources available to members of the legal community, including the Lawyer Assistance Program and the other bar. There's several MCLEs that are currently under development, as Jim mentioned. A wellness one that I'm working on now is called Practicing Well Across the Legal Career. And this examines common wellness issues that are encountered at your early stage, mid-career, and senior points. And this program is being done in connection with CalBar Connect. I really like it because although, let's say, an attorney might be an early career attorney, it's good for them to understand what's coming in mid-career and as they become a senior, and then also understand the issues that the people who they work with who are in the mid-career and senior career face. I've been working, as Jim mentioned, with others on a couple of prevention and detection MCLEs. One is called Sobriety and Beyond, Abstinence and Competent Lawyering. And this really provides perspectives on sobriety from a recovery aspect. And Jim actually gave us our portion on that from professional development. And Heather actually gave us a recorded session on that. And we also wanted to hear about sobriety from monitored lawyer assistance program. So Shelley Frazier gave us a wonderful recorded portion on that. It's currently in development. The second prevention and detection that I'm currently working on is called Overcoming Obstacles, Getting Help with Substance Use and Mental Health Challenges. The idea is to really confront stigma and obstacles to reaching out for assistance. I reached out to the other bar, and David Mann was able to record a portion with us that addresses challenges on overcoming substance use issues. And then I was able to connect with a private practitioner who shared his own struggles with mental health challenges, and that included depression and suicidal ideation. And then there's another wellness MCLE that I'm working on right now, also in connection with CalBar Connect, and that's women's health and menopause. We'll have a doctor from UCLA who will address issues specific to menopause and then strategies to mitigate them to help enable competent practice and wellness. And that's actually currently scheduled for August 19th. Be on the lookout for announcements from the Lawyer Assistance Program about that. And then finally, as Michelle mentioned, I'm currently in the process of executing a year-long marketing plan in partnership with communications to really get the message out for the lawyer about the lawyer assistance program and support that's available. I'll have a check-in with them at the end of July to look at statistics and outcomes for the first 6 months of the year. But as Michelle mentioned, we are seeing an increase in outreach to the lawyer assistance program line, and that includes requests not only for the monitored lawyer assistance program, but also for access to those 2 free sessions with an individual therapist that's available through the program. So on a high level, that sort of describes the programming that we're doing to address all of these really important issues.
Well, thank you. Thank you both for the report. Are those resources that you mentioned accessible? Do we find them just if we go to the website, or what do we do? How do we find those resources, like the program, the training program, or whatever it was, the outreach program for conducting your own MCLE and that sort of thing?
Yeah, so the Lawyer Assistance Program really provides content in two ways. One is by delivering MCLEs, and that was sort of the list of MCLEs. We also create toolkits so that others in the legal community can give presentations themselves. And that's exactly right, Jim. It's on the Lawyer Assistance Program offerings page on the State Bar website. At the very bottom, we currently have our wellness and law presentation, and we'll be including this prevention and detection. And people click a link, they fill out a form, and then they can download the kit, which includes the presentation, notes for the presenter, handouts, and polling questions as well.
Thank you. Anybody want to comment on or ask questions? Yes, Heather.
No, I just wanted to say, Ken, like, excellent job. And I just looked at the LAP website on the State Bar, and there's so much comprehensive information. I'm actually going to go through it and see what I can learn. Because I think that your commitment to really putting the information out there is a testament to how important this program is and how many people it helps, and the fact that we're seeing more people come in who need support is just, we're in a crisis of sorts right now. It reminds me of the 90s, but it's like we're in a crisis. We're in a place where people are really seeking help. And so to be able to put toolkits and information, and I love the little self-assessments that you had on there. I'm like, oh, I'm gonna take those. But so yeah, really, really nice job, really well done. I had a question about the women's health one. I know it's women's health and menopause, but I've been reading a lot of articles lately about women and perimenopause and how badly, even before you get to menopause, like women, particularly in their 40s and 50, early 50s, or like late 30s to early 50s, are just really struggling to, like, the brain fog, the forgetting thing. I mean, I can tell you I have the problem, like not sleeping, all of those things that impact their ability to practice law competently. And I'm just wondering if that's included in that one, or maybe that's something we can think about as a separate one for women's health, of really kind of targeting that age group, because there's a lot of us.
It's my understanding that it will touch on perimenopause as well. I have yet to see the presentation by the doctor who we're partnering with, but I'll make sure to mention that there was a request to make sure that that was included from the Oversight Committee.
Thanks.
Anybody else? Well, thank you. Thanks for that report. It's encouraging that numbers are going up. I like to hear that. That's really good. All right, with numbers going up, then we'll turn to the working groups and I think we have to go back to the minutes. Excuse me. We're going to go to the approval of the March 2026 open session minutes. And let me ask if there are any corrections or modifications to the open session minutes. Hearing none, I would like to have, if you would, please, a motion and a second for approval of the minutes.
Motion.
Catherine Young made the motion,
Approve.
and Ryan Peterson seconded it. If there are no further comments, then would you please, Erica, take the roll?
Yes, Heather Benton,
Say aye or nay if you agree or don't agree to approval.
I think your mic is muted.
Oh, sorry. I was gonna say I abstain because I was not there, so I can't. Yeah.
Okay. Lisa Johnson,
Approve.
Deidre Nguyen, not present. Ryan Peterson,
Approve.
um, Elise Yenny, not present. Catherine Young,
Aye.
and Jim Hiding.
Aye.
Okay, we have one abstain and four yeses, so we have a pass.
Thank you. The next business item then is 4.1, the update and discussion from the Financial Assistance Working Group. And Heather Benton, would you please present on that?
Sure. So Jim and I are working with Michelle to take a look at the financial assistance program that we have on the monitored side. And one of the things we noticed is that we're kind of hitting our limit early in the year. First of all, there's a lot of people who are in need of assistance. There's quite a few people that are law students and other qualifications that are also participating in the monitored program. And one of the things we talked about is really taking a look at how much money people are getting and the demographics. Are these people employed? Do they have kids? Because most everybody is getting the max amount that they can get. And I think we need to take a look at why that is, and is there something that needs to be changed or amended to allow more people to participate. But one of the things we really talked about is looking at people like law students who maybe don't need to be monitored at this time. They're in their first or second or even third year and they're participating, but it's not a requirement. And really, how can we support them and source them? Because the statute says that nobody should be turned away for lack of funds. And so we don't want to turn them away, but we really are thinking maybe we need to funnel them more into the support side or into community-based programs that they could participate in. Because the monitored side is funding is very tight. Let's put it that way. So we've been talking about that. We talked about, whether people are employed by the time they get to the monitored side. And if they're not, that's impacting it because most people fell into, I think it's 200% of the FPL, which is one of those things where you go, like it's very low. I mean, the reality is 200% of FPL is very low. And so it makes me go, okay, if they're a party of one or two, that's only like $30,000, 35, I think, for a party of one. How is that happening? And that's the question we had. We talked about rolling over the funds. I think Michelle is going to look into that and find out if we can set up an account to roll over the funds in the financial assistance program that are unused. So even though all of them are allocated usually by mid-year, not all of them are used for various reasons. People drop out, people are disbarred and no longer eligible to participate, or they just didn't use it by year end. And so it's like, how can we roll over those funds so we're not reallocating to those people who didn't use the same funds? And they can just, have a continuation of it because, we're really crunched. I think it's $33,000 or $35,000 that we have allocated. And right now, most people are getting the full 1,500. We talked about getting people connected with the other bar as well, and kind of the way that the financial assistance program documentation is written, as well as the statute, where we would not be turning people away, but we would be giving them an alternative to participate if they don't necessarily need monitoring. And again, that's law students, people who are I don't remember all the criteria, but there was like 2 or 3 criteria sections that we thought maybe we can help them get connected with the other bar, or maybe we can get them connected with Support Lab or other ways of providing them lab services that are not necessarily monitored because they're not required to be monitored. There are some pre-admission or admission people who are required to be monitored, but there's some people who aren't. And so just figuring out who's required, let's prioritize those. And then the others, if we have the funds, great. If we don't, then we need to try and find other ways to support them. So I think that was everything on my list. Yeah, so that was it. Jim, you're on mute. Still on mute. Jim, you're still on mute.
The studying is continuing. There's no action to be taken right now, correct?
Correct. There's no action to be taken. We're still kind of investigating the situation.
All right, still work to be done. Any questions by anybody? Any input you want to give? All right, well, thank you. Thank you very much, Heather. We're going to move on to agenda item 4.2, the update and discussions from the Review Metrics Working Group, which was consisting of Deidre Nguyen and Catherine Young. So Catherine, you're here and she's not, so I assume you'll be presented by you.
Yeah, sure. Deidre, Michelle, and I met to discuss the review metrics on the quarterly satisfaction survey. And Michelle, if you want to jump in at any time to correct me from my memory. But so we met and we talked about the survey that gets emailed out to everybody who's participating in the program. And what we noticed was that there's been a dip in participation rates after the survey got decoupled from, I might need help with that, Michelle, but it was separated
Yeah.
from the evaluation.
Quarterly report. The participants used to be required to do a quarterly report, so 4 times a year. And that information that I actually think we talked about this with the committee last year. We ended up discontinuing the quarterly report because it was repetitive. Like we were getting their information other ways that were asked on that report, and they used to send the satisfaction survey along with the quarterly report. Well, when you had everybody required to do this quarterly report, and then it immediately, when you clicked the last submit on there, it directed you to the next satisfaction survey, the rate of response was much higher than now when we're quarterly sending out the satisfaction survey on its own, which is voluntary. So that's what Catherine is referring to. It gets sent out to current participants. When you say participants, the participation rate in the survey has dropped, not participation in the program, participation in the survey.
Yeah, the participation rate has dropped, so we have fewer people completing the survey. And then I think also what we had talked about too was that the results we've gotten back look like they've dipped a little bit, like maybe gone down to 80% or so. And maybe that's also because our sample size has reduced. So with the participation rate going down, it would make sense that we would get back fewer surveys, and then the satisfaction rate would go down as well because of that. So we looked at the survey, and it's 15 items, and we talked about which items might be more important or prioritized. We talked about kind of just a lot of issues surrounding the methodology of the survey and whether we might change the timing of it or sending it out, or who it gets sent to, or revising the questions and eliminating some of the questions that are on there to make it easier for people to fill out. And then I think also the last time we met, we talked about Michelle had brought up possibly getting in contact with another branch of State Bar who specializes in surveys. And if that was a possibility, that might help us kind of figure out what we might want to do. So we're still in the process of trying to come up with researching ideas and figuring out what would be a good way to go about changing the survey now that it's it's not going out with the quarterly report.
Yeah, I think that captures it. I can't think of anything else I would add. It's ongoing. So this was just the report, and we're still going to have meetings scheduled, and we'll figure out how the Office of Research and Statistics can also contribute to making the survey improved, either the response rate improved or what's asked on the survey.
I'm sorry for my ignorance, but could we require the survey?
We don't currently require it. Requiring it, the difficult part is saying, well, then what's the or else? So in the monitor program, the or else is usually that reporting the non-compliance. And I don't know that anybody wants to report to the state bar court that somebody was not compliant because they didn't fill out our satisfaction survey. It's not going to go over well with the judges, I think. But we don't really have any other, stick to hit people with, so to speak, or carrot.
Yeah.
Well, it seems like it might be something to consider, you know. I understand that there's the or else is difficult, but even the reminder of, hey, you are obligated to send in that report and you didn't send it in, send it in. I mean, something to increase the responses rather than, I mean, what alternatives are we giving to that kind of ideal? Is there some alternative?
Yeah, Catherine and Deirdre did talk about how just us sending out the email saying, here's a survey, please fill it out, is not the most effective way of doing it, and finding other ways to, for example, give a timeline, like you have 7 days in order to fill this out, and sending reminders in those days. Just there's other ways that they suggested and want to get the other office involved. And maybe they have other ideas, suggestions of how to get the response rate back up again.
It's okay with me to explore everything, but okay. If they have success histories, I assume, you know, with those kinds of things, and I suppose that they would get more than 80% responses, but I think that requirement would be more effective, or at least indicating that it's a requirement. And you know, if you get graded in your English class for a full semester, and one of the portions of your grade happens to be whether you did all your homework, then it might not count for much, but you didn't do all your homework. You got a 98 for this class. You don't get 100, you know, because you didn't do all your homework. So maybe something to that effect, some kind of, well, he complied with everything. He came to meetings. He did his drug test, but he didn't do the surveys. He didn't participate in this, that, the other thing. Just a paragraph in a report that goes to somebody to consider something. So anyway, I would suggest we think about that, Catherine, and maybe, are you going to continue to meet?
Yes, yeah. We have another meeting set up.
Okay, well, it's just one person's feelings, you know, that obviously, so just a thought.
And I
Thank you
was
very much.
actually gonna kind of echo you on that, of requiring it as part of the participation points, so to speak. Just adding it as a requirement of maybe that if we're doing it quarterly, it is a requirement of completing your quarterly evaluation. Doesn't have to go out with it, but it's just, that's part of the process. I also wonder about the name of it. Like maybe we need to look at renaming it, because it's like satisfaction survey, like I don't care. As opposed to like giving it a name that implies that it's important to both them and to us, in terms of how we provide services and support to them. And so that's just a thought of maybe considering the name, engagement survey. So I don't know, something else that might entice people to complete it. My other question is, you mentioned that the scores had gone down. Have you guys looked at what, like, looked back at previous scores and rankings and looked at what we have now and really tried to identify, and maybe they put the other category, whatever, where the discrepancies are, and then taking a look at those pieces of the monitored lap side to say, maybe we should look at this, because you can't infer causation from a survey like that, but it definitely gives you a data point to work with that you can go back and say, okay, they were scoring much higher. Did we make any changes between the last time they were scoring higher and right now? Maybe it's those changes. We don't really know, and then when you put out the next survey, maybe it's, inquiring, throwing in a question about their experience with that particular change. I don't know, but I just think that if the scores have gone down, just because we have a smaller pool doesn't mean the scores should go down. So we have a smaller pool, that's fine. But if we're providing the same kind of support and services, then the scores should relatively stay the same. I've experienced that with other things where I've given a survey to a class and one year it's high, the next year it's low, and you go, okay, where did I go wrong here? If at all. Sometimes it's just the change in people, and people are grumpy, and that happens too. But I think it's worth taking kind of a look at and trying to articulate where the areas are that maybe people are having an issue with. So particularly if their scores were higher and have gone down in a particular area.
Can I clarify that a little bit?
Yeah.
What those scores are?
Please.
The point
Go ahead.
is well taken. Yes, I agree. Just because there's a fewer number of people responding doesn't necessarily mean that the percentage of satisfied would go down. However, it is a very, very, very narrow number. So this is the response to one question on, so what were there, about 15 questions on the survey? There's one question which is about overall satisfaction if the LAP met my needs. So we're looking at whether they agree. It's a 5-point Likert scale. So they agree, strongly agree, neutral, disagree, strongly disagree. So do 80% or more agree or strongly agree that the LAP has met their goals. And our metric is that we want that this is the one that we've talked about that we report annually to the board. It goes in the annual discipline report. So are we still above 80? Yes, we're still meeting that 80%. But we've gone from, I was trying to pull it up while you were talking here, from numbers like in the 60s basically to 16 responded to the last time. So it's really the number of people have dropped. So we're still over the 80%. We're generally people are still satisfied, but we're talking the difference between like in the 80 to 90% range, it's gone more from the 90 side to the 80 side. And we've gone from 60 or above responses to this last time around 16. So I don't know that that's enough information yet to say, it's because we did something different, but it definitely seems like we did something different in the way that we're distributing the survey because the response dropped so much. So we will keep looking at all these, and this is why we made the working group on it for 2026 is to look at all these different aspects of it.
And the responses that you get will be skewed because people who respond either really like it or really hate it, and that's the reason they're responding. So it's kind of something that we really should look at to get a better response rate. I mean, really look at it hard.
Yeah, I really do think it should be required, one. And two, one of the things that I've done to kind of dig into, why people are responding the way they are. So it's like, did I agree that LAP met my needs? And if it's like no or whatever, then you have a subcategory. Instead of having other where they just free form, you have a subcategory that says like, reasons that it didn't meet my needs, groups are unavailable, whatever it is, and see if people kind of tap in those areas. And that'll give you a little more information about what it is. And it's quick. It's a multiple choice, select, the top 3 reasons or whatever. And so it doesn't add a whole lot of time to the survey, but it gives you more information because to me, just asking if it met the needs, it's like helpful to know that, but it doesn't tell us what we need to change or improve, if anything, to meet someone's needs. So and sometimes, and like Jim said, when the response rate is low because people either love it or hate it, that still gives you a data point, but I do think we need to look at making it mandatory as a part of their participation in the program. We're asking for feedback. You need to get us feedback. I mean, I think it should be as simple as that. Like it's required as part of your participation in the program. We need feedback to continue running the program. Like I don't think there has to be why should I do it? We're asking you to do this because it's part of your program. And if you don't, we'll note it in your file. But it's like part of participation. Like, we talked about successful marks for participation. It's like, come on, just do it. It's 5 minutes of your time.
Okay, well, these things have been helpful. This discussion has been helpful. I think that Catherine, you see where people are going with this, and Michelle, and maybe, you're absolutely correct in pointing to a group of professionals within the state bar who do surveys and who can put that together. It depends. I think my interests are costs here in part, and so it depends in part on the costs and how much that gets allocated away from us to do that kind of professional consultation. So, I mean, it's all good, and I think that's placed. Heather was bringing up some questions and some methods that would make it more realistic, but difficult, for us to just fashion that. At least difficult for me because I'm not a professional in making those surveys. So anyway. Any other questions? Catherine, did you have anything else to say? Everything just shifted around, so I'm looking over different parts of the screen. So, Catherine, did you have anything else you wanted to add?
No, thank you for the feedback.
Thank you very much for your help and for your meeting and putting this together. And you too, Michelle. Thank you. All right. The next is item 4.3, the update and discussion from the Practices and Procedures Working Group, presented by the working group of Lisa Johnson and Ryan Peterson. Whoever is going to present, I don't know.
Go ahead, Lisa.
Well-
You're senior.
I can start. We met last Friday, a week ago today, and it was myself, Ryan, Michelle, and then Kara Fletcher, who was identified as the clinical analyst in the program, who does the actual interviews for the applicants. So Ryan and I had been reviewing the intake assessment to give feedback on that, and I think I speak for both of us when to say that we thought it was well written, and we didn't have any really anything negative to say about it. We did have a couple of points we wanted to make that we thought would make the document a little stronger. One of which was in the category of substance use history. We thought that if there were a question about the previous monitoring experiences that the applicant might have had in terms of prior treatment that they had participated in, having that information would, make the, I guess, the assessment more complete, would be valuable information. Another area we thought would strengthen it was to look at relapses and to identify what if there were triggers in the past for the individual, and that would be something useful to know and helpful for current future treatment. That was, I think, Ryan can add to that if there's something else or additional he recalls. But that was the feedback that I recall, and Kara was very helpful in explaining how things work and what she does, and Michelle also helped us with this process. So that's it in terms of our review. Are there any questions about the document, or Ryan, do you want to add anything to
No,
that?
well said, Lisa. I mean, I think we overall really liked the way that it's being approached and Kara's approach and the questions that are being asked and the things that are being looked at. I mean, it was our additions were very minor overall.
Yes. Thank
Okay,
you.
and that's good. And I'll remind everybody that Lisa's a or excuse me, a PsyD, and Ryan's an MD. And so we appreciate your professional review of those things. I mean, it's important, really, and it adds some respect to the input that you have given it. And so I very much appreciate you putting your time and effort into this. Anybody else have any questions or comments? Okay, that concludes the agenda. Let me say that it's been a pleasure to chair this meeting particularly for me, because I think that what you've done over the last few months and in reporting today is exactly what the Oversight Committee is to do, and that is give oversight. And so I think that you've all done that. You've put together time and effort into different aspects of this program and different aspects of this section of the State Bar that are very meaningful, and you continue to do that, and you have given your views and your oversight and your criticisms and compliments to the efforts of the State Bar and to the improvement of the program coming up in the future. So I appreciate that very much. I commend you for it. I want to mention there's always an invitation to submit items for publication or participation if you want. If you have a paper or an article or something you want published, please submit it so that we can look at it and help get that accomplished. Please be thinking of imaginative, innovative ways to spread the word and spread our services out to as many people as possible. Increasing costs mean decreasing our spend capabilities in other areas. So that's going to be a continuing concern as we go forward. But our next meeting is scheduled for Friday, September 25, 2026 at 2 p.m. It'll also be a remote meeting, so we'll be getting notice of that in the future. Does anybody have any additional comments or questions? You sure? Okay. Okay, well, thank you all. We're adjourned. Thank you very much. Thanks, everybody. Take care.